Welcome to TCCC-Plus Day 2, Module 10, Introduction to PAWS-L. This module covers the PAWS-L framework and the medication pill pack overview. March saves lives early. PAWS-L preserves life over time. And a delayed evacuation creates a different set of risks: pain, infection, hypothermia, rebleeding. We have already covered some of these in the March reassessment parts. The rest we will go over in the following modules. This is covered by the PAWS-L mnemonic and is what you do across the hours and days once the first-minute killers are handled. PAWS-L is a mnemonic for pain, antibiotics, wounds, splinting, logistics. The fifth letter, L, logistics, concerns the resupply and power planning that lets you keep doing the other four over days rather than hours. You may remember that as anticipating resupply or lack thereof, and it gets its own module at the end of the day. Keep it in mind because every element of PAWS-L runs out if nobody plans the resupply. Note that PAWS-L can describe a timeline: pain relief early and repeated, antibiotics started and continued, wounds tended over days, splints holding, logistics keeping it all supplied. Again, March saves the first minutes, PAWS-L preserves life over the hours and days that follow. Pain. Pain is a problem in itself, but it also drives physiology: a fast heart rate, shallow breathing, exhaustion, a casualty who cannot cooperate. None of these help the casualty. It is also a tactical problem by hindering evac, possibly making a lot of noise, and maybe keeping an otherwise helpful team member out of the fight. Antibiotics. Every combat wound is high risk for infection. Antibiotics may be indicated for all contaminated penetrating injuries. If so, they should be given early, but the PFC point is that one dose is not enough for a long hold. You need to continue dosing per protocol, choosing the agent by availability, whether moxifloxacin, cefadroxil, or cephalexin. Moxifloxacin comes from the older guidelines and remains an acceptable alternative. The current preference is cefadroxil or cephalexin, but on the ground this is an availability decision. Plan resupply or telemedicine. Having more medications available than just the basic pill pack may be necessary to keep our casualties going in a prolonged evacuation setting. Wounds. Infection control doesn't start with antibiotics though, but with source control. Clean and dress the wound, change dirty dressings, monitor, protect, but do not overhandle it and do not explore it. Splinting and stabilization. Splinting reduces pain, bleeding, and further injury. Stabilization here means packaging for a long wait and transport, comfort, warmth, safe movement. The pill pack covers initial doses: pain, an antibiotic, an antiemetic. Treat it as a starting point. Sustained care needs repeat dosing and resupply. Other medications than the pill pack are given by protocol or telemedicine only, documented and followed by reassessment. Thanks for watching Module 10 of the TCCC-Plus course, Day 2, Introduction to PAWS-L. Next up is Module 11, Pain and Nausea.